So I'm going to talk about exercise as an intervention, particularly in early psychosis, but I was also requested to do and beyond, so that's my animation. And I just thought for people who don't really know much about early psychosis, it would be helpful to have an introduction to why this is an important subject. So obviously with schizophrenia, it's a major health problem, both from a personal and economic and social point of view. Affects about 1% of the population, and the tragedy is that it usually begins in young people, so teenagers and early adults. And then in many people it's a long-lasting illness, so you've got young people who then have this illness in the prime of their life that then has a long duration. So when we talk about early psychosis, what we're talking about is the first episode of psychosis and then the few years that go after that. So that's what we mean by early psychosis. And the significance of early psychosis is that the first episode of psychosis and the few years after that is the time when the most deterioration in ability to function in society occurs. So as I've done this fantastic animation here, you can see that this is before the onset, somebody's functioning relatively well, but then there's a rapid deterioration around that time of the onset and the few years after that. And this is why we call this window of opportunity here the critical period. This is the period where we really need to focus on to try to prevent that deterioration, to minimise the disability and to promote recovery. So that's why this is a really important period to focus on. And the strategies, very briefly, around management of early psychosis is timely access to care, high quality care, tenure of care. So when I say tenure of care, what that means is that the young person comes, they've got their first episode of psychosis, it's all very well to manage those symptoms, but what's then very important is that that person is able to access that service for at least a few years without being in crisis. So rather than just manage the symptoms, say, okay, you don't have psychotic symptoms anymore, you can go be managed by your GP. It's very important that they access comprehensive and specialised care, even when they're not actually psychotic, so that they can focus on things like their recovery. So they can focus on things like getting back into work, getting back into peer networks. So that tenure of care is very important. And the length of care, obviously it'd be best to manage these people really for the whole duration of their illness. Economic constraints usually put some dampener on that, so sometimes say 2 years, 5 years. What's not known is really what's the maximum time that can be economically justified. So in terms of timely access to care, this is an issue for young people where the worst thing that you could do is they present for help and you tell them to go away, they're not sick enough. And this is what it can feel like sometimes for people who are trying to get care. The inconvenience stores, they can see what they want up there but they can't reach it, or like this. This is an actual photo. So this is what it can feel like sometimes if you don't focus on timely access to care. So in terms of early intervention services, the high quality care is important as well. So focusing on young people, a biopsychosocial approach, not just managing the positive symptoms of psychosis, but actually focusing on recovery, as it says. But you'll notice that, so with these early intervention services, we know that they're effective. We know that they improve outcomes. So there's been studies that are looking at the long-term outcome of people who do and do not have access to early psychosis services. And as you can see from this slide, there's higher rates of recovery and remission in up to 10 years so far, the research has shown. And that's recovery defined as both symptom remission and functional recovery. However, there is one group that are not showing the recovery that would be ideal, and that's people with who present with high levels of negative symptoms and cognitive disturbances at the time of presentation. So negative symptoms such as low motivation, lack of social networks, reduced facial expressions, reduced ability to communicate emotions. So these are the people who are really struggling to recover. And people with neurocognitive disturbances, so problems processing information, problems with memory, are also the ones who are less likely to recover, even when given timely access to care and high quality care. So there needs to be a focus on these people. The other thing that's not been a focus, now I'm not sure how you go backwards, but the other thing that's not been a focus is physical health. So it's only recently that people have really taken an interest in the physical health of both people with schizophrenia and people in the early stages of psychosis. And we know that even prior to the first episode of psychosis, that young people presenting at this stage have already got compromised physical health. So they have high levels of smoking, they've got high levels of saturated fat, their BMI is higher than their non-affected counterparts, and they've got higher fasting glucose and insulin resistance. So already, before they're even on any medication, they're struggling with their physical health. And then, of course, you put them on antipsychotic medication, and that straight away compounds the problem. So this is thanks to Mario Alvarez for this slide, which shows the rapid and quite marked weight gain that occurs once somebody's put on antipsychotic medication. So you can see here that in the first 12 months there's a really rapid weight gain, but it doesn't tail off, so people continue to actually gain weight. And this is a fairly shocking slide which shows you the blood glucose abnormalities of people in different stages of psychosis. So the first episode of psychosis, already there's glucose abnormalities. So you can see blue is diabetes and orange is pre-diabetes, so already raised blood glucose, and it continues to get worse. And this is an even more shocking slide, which actually shows you the percentage of diabetes in people suffering with schizophrenia compared to the general population. And if I can just highlight here, you can see that aged 35 to 45, 6.1% of people with schizophrenia have diabetes. That's equivalent, you can see, to their counterparts in the general population. Here, aged 55 to 65, 5.8% with diabetes. So, people with schizophrenia, they're known to die 20 to 30 years earlier than non-affected people. And one reason is that their physical health is like they're 20 to 30 years older. So really quite shocking statistics. So in summary of what I've been talking about, when we're looking at early psychosis, we've got this window of opportunity to reduce disability, but there's really two clear gaps in our knowledge and gaps in our treatment. And one is, how do we reduce the negative symptoms and the cognitive disturbances that really show that those people are less likely to recover. And the second one is their physical health. So we need to intervene early to prevent that deterioration in physical health that we know that occurs. And what is something that could actually target both of those and be effective for both of those things? Exercise. So that's why we've got this symposium today, to really look at what's a simple, low side effect, should be accessible treatment that could be effective for both of those issues that we're facing in early psychosis, the negative symptoms and the physical health. So just to show the potential of exercise, even in people with serious mental illness like schizophrenia, this is a meta-analysis done by my PhD student Jo Firth, who I'll talk about in a bit more detail shortly. And in the meta-analysis, this is really quite remarkable that something like exercise can have this effect on cognitive disturbances that have been so resistant to treatment with many other forms of treatment. And this shows that exercise was effective in improving global cognition. And the other feature to highlight is that particularly if exercise is supervised by somebody with specialist knowledge about physical health, it was more effective. and I'll return to that, and that will be a theme this afternoon, really, about how do you get people to exercise. So now I'm going to talk about our pilot study that we did in Manchester that was looking at the effects of exercise in early psychosis patients. So we knew that it was effective in cognition in people with schizophrenia. What about with people with early psychosis? So we called it IBEEP. It sounded like a kind of cool name. It means investigating the benefits of exercise in early psychosis. We designed this logo and then realised that it was probably a bit of a rip-off of the British Heart Foundation, but luckily they didn't discover that. And what we did was a feasibility trial. We actually allowed ourselves 9 months to recruit patients from the early psychosis services around Manchester, but we got all the referrals that we wanted, which was over 30 people within 2 weeks, so that we were actually saying, no, we can't take any more people. And this is because obviously the mental health staff realised that exercise was a good thing, and they were very keen when we said that we would get these people to have supervised exercise with our team, that they were very keen to refer. In addition to usual treatment, so when we actually put this in to request funding, the feedback that we got was like horrified feedback from psychiatrists who said, how can you possibly use exercise and not antipsychotics? Misunderstanding that this was in addition to the usual treatment that they were getting. So in addition to both antipsychotic medication to control their positive symptoms and the biopsychosocial treatment they were already getting at the early intervention service. So I'd like to pay tribute to the team that actually did all of the work. So this is Joe Firth. Well, he's the one that's doing the flagpole. So obviously very good core strength. And when he went around to talk to people about potentially being in the study, the young men said, yeah, I want to look like you. And the young women were sort of like, yeah, I want to hang out with you. And Rebecca Carney, she's a very keen runner, and she was also doing the supervision of the exercise with the young people. And what they did was not just supervising exercise, but they would pick the people up, take them to the gym, give them an option of what they wanted to do. Actually, most people chose the gym, and then actually do the exercise with them. So they would sit there on a rowing machine with them, they would do weights with them. Rebecca, who hates swimming, actually went swimming with one of our young people. Like I said, we did give people options, so we also wrote to Manchester United Football Club and Manchester City Football Club, who were the local teams. We only heard back from one of those teams, which was Manchester United, who offered access to their Manchester United Foundation facilities so that people could go. The Manchester United Foundation tries to engage the local people of Salford and Trafford, giving back, a multi-billion-dollar company really, but trying to give back to the local community. So they were happy for us to access their facilities. But actually nobody chose to do that. In the end, most people wanted to just go to the gym, which is an important question about why did they choose that. They wanted to go at quiet times, so not when lots of people were there. And I guess they felt safe. They didn't really want to go running because they felt like they might run out of breath and be far from home. And they sort of felt, I guess, more contained. So what we did was we, as I said, talked to them about what they wanted. And actually over 10 weeks, the young people, we were aiming to get 90 minutes of moderate to vigorous activity, physical activity, and actually they showed that they achieved on average 107 minutes of moderate to vigorous physical activity per week, which is quite a lot, and certainly what we hope to achieve. We looked at the outcomes, which were both on, well, not both, Stephen will pick me up on my incorrect grammar. So it was on symptoms, physical health and cognitive health as well. And you can see from this slide that this is what their PANSS scores were like at baseline, and then post-intervention So the blue is the baseline, the red is the post-intervention, and you can see that on total PANS, so it's measuring positive, negative and general symptoms, there was a reduction. There was a slight reduction in positive symptoms, and there was a more marked reduction in negative symptoms and in general symptoms. And if we looked at comparing the people who were in the study and doing this exercise to a comparative group of recruited from the same area and not receiving early psychosis, not receiving exercise, there was actually a significant and quite strong effect of exercise for both the total symptoms, the negative symptoms and the general symptoms. So that's what those little stars are there for. So that was a significant effect of exercise in reducing those symptoms. As it says there, so significant improvements also observed in psychosocial functioning, in verbal short-term memory, so on the cognitive effect, a decrease in waist circumference, not a reduction in BMI, interestingly enough, but evidence of reduction in that central fat, which is the one that's most associated with all-cause mortality and cardiovascular disease. So that was heartening to find. We also interviewed the young people who had been through our program and asked them about what the experience was like for them. And as you can see, there was a lot of positive comments about improvements in motivation, so I won't read those out, but you can just quickly get the gist of that. People also talked about improved confidence through engaging in exercise, which for this group of people was very important. So I won't read them all out. And also in terms of recovery. So after we finished our exercise intervention, so at the end of 10 weeks of exercise, we then actually followed the group up at 6 months. So we managed to follow up most of the people, and unfortunately one of the problems was that not everybody managed to keep up the exercise once that intensive support was withdrawn. So this is really a major issue, and I think, Phil, you're going to talk about this afternoon or later today about, well, how do you get people to keep up doing exercise? Because once that support of somebody picking them up, taking them to the gym, doing it with them, unfortunately just over half of our participants were still doing exercise. So this is clearly an issue. And that was despite them being very well engaged in exercise beforehand. So it's consistent with finding that really in long-term schizophrenia, that shows that that supervised exercise, as I highlighted in that meta-analysis, is the most effective. Providing advice about exercise, telling people to exercise doesn't work. It doesn't work in the general community. We all know that exercise is good for you, and it certainly doesn't work for young people with mental health problems. Interesting, those that did manage to continue to exercise actually didn't just show maintenance of positive results, but they continued to improve in their psychosocial functioning, in their symptoms and in their confidence. So this gives you a bit of an idea. This is the total PANS. Just to be confusing, the red was the exercises before, but now the blue is the exercises. And so you can see that the non-exercises, they bounced back, unfortunately, to high symptom levels again, but the exercises continued to have a reduction in their exercise. So the take-home messages about exercise in early psychosis. Exercise is effective in reducing negative symptoms if, again to emphasise, if used in combination with their existing treatment. Supervision is effective at engaging people, but ongoing support is needed. Now, Stephen did ask me to talk about early psychosis and beyond, so there's Buzz Lightyear again. This is not my special subject, anything apart from psychosis, so just to give you a gist of this, looking at exercise as a treatment for depression, and to highlight that actually one of the authors of this paper is in the audience, so he can talk about it in more detail. But this was a meta-analysis looking at exercise as a treatment for depression. There's been some controversy, people poo-pooing that idea, but actually what this study found was that we've probably been underestimating the effect of exercise in depression. So this is a meta-analysis, aggregate meta-analysis with the effect sizes. And you can see that little red diamond down there, that shows that it is effective and actually has quite a large effect size of 1.11, I think it was. Was it Phil? He's sort of non-committal, but that is... So exercise had a large and significant effect on treating depression, and it was again strongest for aerobic exercise of moderate intensity, and strongest if people were supervised. So just to hammer home that point about you can't just tell people to exercise. So finally, in summary, exercise is effective as an adjunct treatment in the treatment of schizophrenia and early psychosis. It's effective in depression, and supervised exercise is more effective than non-supervised exercise. So this is a highlight from a paper that appeared in the American Journal of Psychiatry some years ago, and what it says is that it's no longer a knowledge gap. We know that exercise is effective for a range of physical and mental health problems. It's an implementation gap. And this was a few years ago. It's still an implementation gap. So the challenges that we face are the maintenance of exercise, making sure that people have access to facilities and support over the longer term. And we need to make sure that we know, as I keep saying, supervised exercise is effective. We need to make sure that we have got adequate funding to see that physical health specialists, exercise physiologists, should be an integral part of the team. You know, people would have laughed at you like last century if you'd said that psychologists should be an integral part of a mental health team. Well, hopefully people will laugh at us in 20 years' time when we say, oh, we didn't have exercise physiologists and physical therapists as part of the clinical team, when really we know that this is such an effective treatment for a range of symptoms. So I'm going to leave it there. There's some time for questions, but then I'm going to, and this is actual footage of me handing it over to Emily Fisher. So this is a clip from a Madison race, and I don't know if anyone's seen a Madison race, but actually they're in the velodrome and they sling each other forward. So Emily and I actually did that, and in the same way I'm going to sling it forwards to Emily to take it from here. Thank you.